friends and loved ones. It's very great privilege, a very great honor to come to your homes as we have this discussion. So the discussion, the topic, snapping hip syndrome, or we say Coxa Saltans as the scientific term or state. So what is Coxa Saltan or snapping hip syndrome? It's actually a syndrome or condition that affects the hip region. So in the hip, anatomically, or we have some structures around the hip we call the hip bone. So around the hip bone we have muscles, we have muscles such as iliotibial band, we have the iliopsoas, we have the gluteal maximum. We have so many structures around the hip, and so we have tendons, we have ligaments, we have nerves, blood vessels, so many structures around that. I have fascia, and so. But today's topic is actually mainly concerned about tendons being unstable, and so they produce something we call a snap or a click sound around the hip. So first of all, what is snapping hip syndrome, or we say SHS? SHS doesn't mean that it's SHS senior high school. It means snapping hip syndrome. That's SHS. SHS. It's also called Coxa Saltans. So what is snapping hip syndrome? It's actually a presentation by a person. So a patient comes or the hospital or is complaining of the patient bending downwards and hearing a crack or snap sound around the hip region. It hears and going down. So this needs to be taken into consideration as very much as early as possible, because weakness around the hip region could cause so many disabilities, could cause you not being able to go to work, could cause burden to your family, and so many things. So therefore, if you have noise or you've been hearing some noise around the hip region, that's you need to report to the medical personnel or the medical practitioner as early as possible, and this will help to save you and your family from bearing extra cost. Okay, so what is snapping hip syndrome? As we said, it's a noise heard around the hip region in the form of a crack or a snap sound, and so this condition actually affects these structures. One, the iliotibial band. We'll show you some pictures very soon. Iliotibial band. It also affects the Iliopsoas tendon, and so we'll show you some pictures on this tendon. And then also it affects your activity of daily living. So you're not able to walk well as you bend to pick something on the floor. You feel pain or you feel the crack sound, and this could be a very big blow and very weak loss to your family and the society. So we have three types of this SHS or the snapping hip syndrome. We have the external type, we have the internal type, and we have the intra-articular type. And so first of all, the external type is actually affected by this muscle extension of the tendon called the iliotibial band. And then also the second type is called the internal snapping hip syndrome. We have the structure being affected is the iliopsoas tendon, and the intra-articular actually type of this SHS or snapping hip syndrome is actually affected by some cartilage or intra-articular structures in around the hip. So the external type actually is prevalent, but then it starts gradually, because activities that involves you to raise people who raise things, such as those who go do weightlifting, they don't really experience it very early. It becomes, you see some micro tears, micro damage, but then after a while the weightlifter experiences pain around the hip and hearing the crack sound. So it's actually a gradual onset in terms of this condition. I mean, it's not associated with any traumatic event. It's not just a blow that causes the SHS or the snapping hip syndrome. It's gradual. And so we need to take into consideration listening to the listening to the sounds as best as possible. No matter how small the sound is, you need to really take into consideration and then deal with it as early and as best as possible. And so we need to, as we said, we need to take into consideration the sound as early as possible. And it could create other complications. So if your hip is weak, it goes directly into your knee and goes directly into your foot. So then it could make you unable to walk well, and then also it can make you bedridden in a short while. But then the internal one is actually associated with a traumatic event. So imagine someone blows you around your hip region, or you fall in the gutter. It could cause this structure called the Iliopsoas Tendon to be injured, and this is very, very important as physical therapists. So we look into through our assessments and through our special tests to see whether the Iliopsoas tendon has been affected. And then through a test, we have so many tests. We have Thomas tests. We have so many tests that we go through. And then if it's injured or if it's affected, we start treatment as early as possible. Actually, the intra-articular type affects the hip joints. There's a structure called the capsule around the hip. So in the case where there's, because this structure to be malfunctioned, so you're able to walk, and then you'll be hearing these sounds around the side. And actually it has its source mainly in children, where they have recurrent dislocations in terms of the hip. So when a child comes to the hospital and the child has the shoulder shifted up the joint and in of the joint, especially those who are sickle cell, they tend to have weak structures, and so they are likely to have recurrent hip dislocations or subluxations, and this should be taken into consideration as early as possible. And we have special exercises that we do to strengthen the hip, strengthen the tendon, and even strengthen the structures around the side, just as the capsule. And so this should be very, very key in terms of management, physical therapy. So when you have such complaints, you have to see the physical therapist as early as possible. There are other conditions that could look like this condition called SHS, or snapping hip syndrome. We have trochanteric bursitis, we have the Iliopsoas iliotibial band syndrome, we have Iliopsoas bursitis, we have so many conditions. But then through our physical examination, through our differential diagnosis, we are able to rule them all out, and through the use of our investigative procedures such as the X-ray, the MRI, which is very, very effective. We can do the CT scan, and our special tests. We are able to rule out other conditions and then treat this condition as snapping hip syndrome as best as possible. So the main complaint and the very indicative probability of snapping syndrome having occurred is hearing the snap sounds or the crack sounds by bending or flexing, as the scientists would say. So there are some things we call outcome measures that we ask patients as a follow-up. So every week or every day that the patient comes, every session, we go through questions, or probably in the 3 weeks or 6 week sessions, we ask the patient how the patient is feeling, and so we can see the improvement within the time range of about 6 weeks. Yes, so we have an outcome measure such as the lower extremity functional scale, we have the hip disability, and osteoarthritis outcome measure. So other conditions such as osteoarthritis, that is weakness around the hip region, or hip osteoarthritis, could look like this condition called a snap hip syndrome, or could even be in combination with this condition. But then being able to differentiate and then identify it as early as possible gives us a very, very good outcome. So as physical therapists, we go through a systemic assessment procedure by asking the patients the history, the complaints, how painful the place is, what movement causes the pain, how severe the pain is, what positions causes the pain, which activities cause the pain, and then various movement that cause the pain. We check for muscle strength, we check for the structural strength around the hip region, and also we do special tests. So there are very, very specific special tests that the patient is taken through. We have something we call the Faber test. The Faber test is FABER, flexion, abduction, external rotation. So the patient bends the hip forward and turns the hip inside. No, if the patient bends the hip forward, the patient opens up the hip and then turns the hip inside. So let's take it again. It's flexion, abduction, external rotation. So first of all, the patient turns up, sideways, out. So you get it, up. So if there's a hip, it goes like this, up, and hip syndrome. In terms of management, before physical therapy, if it's earlier indicated, we go through the rest, ice, compress, and elevate. If it's very painful, we rest the place, we ice the place, and we make sure there's less movement to ensure healing. So when the pain comes down, which is a very good indicator of starting physical therapy. Yeah, so we go through physical activities such as strengthening exercise. You have straight leg raise exercises. You have so many exercises that we go as physical therapists. So before that, we are giving either pain medication to relieve the pain. Then the physical therapy starts. We have straight leg raise exercises. We have, if the pain is not so severe, we have quadriceps bench exercises to strengthen the leg through to the hip region. We have also stair climbing exercises. We have single leg standing exercises. We have squatting exercises. We have variety of exercises that we go through with the patients. When the condition is very severe, the only option we have is to do a surgery, to carry out a surgery. And this is actually the latter stage of the condition. We have so many surgical procedures that we go through. The surgeon will go through with you, and after the surgery, you come back to physical therapy for return to function and return to work. So we have the Z-plasty of the iliotibial band tract. We have resection of the posterior half of the iliotibial band or iliotibial tract. So many structures, so many physical procedures. And so it's very important that as early as possible we return and see the doctor, and then we're able to see to the best of our ability how to return to function. So let's take note. If you have this condition, report to the medical doctor, report to the physical therapist as early as possible. It's called a snapping hip syndrome. It's felt around the hip. So mostly this presentation comes about when you try to bend your hip. So when you try to pick something on the floor, you hear a crack sound or a snap sound around your hip. If you hear such sounds, immediately try and see the doctor or try to see the physical therapist, and then you be treated accordingly. There's a very good prognosis in terms of having this condition treated and return to work and return to function as best as possible. So don't keep it to yourself. Don't say it's a small sound. Don't say it's a small sound. If it's recurrent, it's very important that we take into consideration reporting as early as possible. So let's look at some pictures. I'm sure we've talked a lot. Let's look at some pictures indicating this condition called snapping hip syndrome, or SHS, or scientifically called Coxa Saltans. Okay, so yes, we can see the hip here. Yes, so this is the hip. So we hear the crack sound around the side. You can see the Saltan or snapping hip. So it's first around the side. So you hear the sound here. So yes, so this is called the iliotibial band. Yes. So this is the external type of the snapping hip syndrome. The internal one is actually affecting the Iliopsoas Tendon. We'll see the Iliopsoas Tendon very soon in our next slide. Okay. Psoas Tendon. Oh, okay. Okay, so it's not. Yeah, okay. So this is the tensor fascial lateral, another muscle here. This is the iliotibial band. So this is the iliotibial band. Yes. So the end of the iliotibial band is the tensor fascial lateral. That's the muscle. So the iliotibial band is actually a tendon, an extension of the tensor fascial lateral. And you have the thigh muscles. You have the vastus lateralis, vastus medialis, and you have the rectus femoris. These are all thigh muscles. So everyone has this muscle called these muscles. Everyone with a thigh has these muscles. Rectus femoris, vastus lateralis, vastus medialis. These are our anatomy of the thigh. And then this is actually the hip bone. The hip bone. This is a hip bone, and this is actually the hip joint. This is the trochanter of the femur, and so these are all very important. So the iliotibial band crosses over the head of the femur. You can see it here. So you can see it around here. You can see it here. As the iliotibial band crosses the tensor fascial lateral around the hip, so it protects the hip and gives stability to the hip. So this is it here, the iliotibial band here. So in the case where you hear a snap sound around the side, you can see it here. If you hear a snap sound on bending, if you hear a snap sound around the side, it's indicative of a snapping hip syndrome. Under normal circumstances, you're not supposed to hear a sound because this structure helps to stabilize the hip and prevents extra movement in the hip. So these are tendons around the hip joint. These are ligaments. So they give strength to the bone and protect the bone from excessive movement. These are all structures around the hip. You mentioned about, we have the pelvic bone. This whole structure, this bone is called the pelvic bone. We have ligaments supporting the pelvic bone, but we are talking about the hip region. We have ligaments, the pubofemoral ligament, the iliofemoral ligament. Yes, so many structures. And so this is the point where we have the snapping hip syndrome. Yes, so you can see here, shaded here, we have other muscles. And so this is the internal types. We mentioned the internal type affects the Iliopsoas tendon. So this is it here. Okay, this is actually a patient having this condition. And so these are some exercises that as physical therapists will go through with the patient having this. Depending on the severity of the pain indicator doesn't mean that we should limit exercise. With reduction in pain, then the activity increases. So physical therapists take reduction in pain as a very, very good indicator to continue or to increase activity as best as possible. So we have hip flexor stretch exercise at the initial stage. We have the quadriceps stretch. So this is the position of the patient. The patient stands and stretches bend the hip backwards. We have the hamstring stretch exercises. We have the sideline stretch exercises. We have a variety of stretch exercises, and these are very important to relieve pain. And it could be also tightness around the iliotibial band. If you have tightness around the side, it could mean that you need to stretch the side, and with that, pain can be resolved. So this is an X-ray of the hip, that's the pelvic region, together with the hip. So X-rays are taken to be able to see the other diagnosis that should be ruled out before diagnosing the condition as the snapping hip syndrome. So we have a physical therapist trying to do a test to be able to identify whether it's snapping hip syndrome or not. You mentioned the FIBA test, the flexion. That is the physical therapist is bringing the patient's foot backwards. So flexion is flexion, then abduction is to this side, and then external rotation is out. So it goes out like this. Okay, so these are some of the exercises. Also another exercise, we can see some pictures here. So also we go through all these exercises to be able to get the patient to return to function, and most importantly, the patient is wrong to return to work. It could affect anyone. And so let's take into consideration this. And so it also affects those involved in high impact activities such as footballers, and these are very important because these are all anatomy of the condition. And so the external type affects, as we mentioned earlier on, affects the iliotibial band. The internal one affects the iliopsoas tendon. The intra-articular type affects the hip capsule, which we've seen it in. So this is someone who has got snapping hip syndrome, indication of pain. So this is actually where it's affected around this side. These are our anatomy of the structures around the hip. These are pelvis, the thigh bone, and then other structures, the muscles, the tendons. Okay, so the pelvic bone. These are the very good picture giving us all the bones in the hip and the joints. Okay, this is a physical therapist trying to treat someone with snapping hip syndrome. Okay, so this is a topic for today. Today is 1st of September 2021, and this is someone doing an exercise to strengthen the iliotibial band and then the iliopsoas tendon. Okay, so wow, I'm sure you've seen these pictures, so many pictures. I'm sure we've had a wonderful discussion, and so thank you very much for your time, and I'm sure you can pass on the knowledge, and you can also share the video to others. Have a blessed evening, and may the good Lord be with us all. See you. And so the next topic will be rolled out on our platform very soon. In fact, before the day ends. Have a wonderful time. Goodbye and take care.